Hello viewers, today we will learn how we use the electrical stimulation in physiotherapy. So let's start. So we as the physiotherapists applies the suitably modified electrical current through the electrodes placed on the skin to stimulate excitable tissues like nerves and muscles to produce the therapeutic benefits like muscle strengthening, muscle re-education, pain relief, and etc., and many more. So there are various electrical currents in the use of physiotherapy. So let's learn one by one. The first one is Faradic current. So what is the Faradic current? Faradic current is a short duration interrupted direct current. Short duration means the pulse duration is 0.1 to 1 millisecond, and the frequency of the Faradic current is 50 to 100 hertz. Faradic current is used in search form to produce tetanic contraction and relaxation. And one thing, the Faradic current only applicable in the innervated muscles. Innervated muscle means the muscles whose nerve supplies are intact. So we use the Faradic current as a treatment in the cases to facilitate muscle contraction, which is inhibited by the pain. Suppose you have an injury, so the contraction of the muscle is inhibited by the pain. So in that case we use the Faradic current. And also muscle re-education. Muscle re-education means after a long period of disuse of any muscle, we use the Faradic current to restore the sense of the movement. Another current is galvanic current. So here's the use of galvanic current is same as that of the use of Faradic current, I have said. The only difference in it has the frequency of 30 hertz something, and it is the long duration current. The pulse duration is 1 millisecond and above, so it can help in the stimulation of denervated muscles. Denervated muscles means nerve supply of the muscle is totally destroyed. So in that case we can use the galvanic current. Now again comes to the Faradic. We can use the application of the Faradic current in various methods. Like the first method is NMES, means neuromuscular electrical stimulation. In NMES we use a device that sends electrical impulses to the nerves that causes the muscles to contract. So this is the same principle of the Faradic current. So it is used to build strength after surgery by increasing range of motion, and the main use of NMES is basically to the rehabilitation, to restore the total neuromuscular function of the body. So that is the main use of NMES in physiotherapy. Another one where we use the application of the low frequency current like Faradic current is the EMS, means electrical muscle stimulation. So it is used to strengthen the muscle, to improve the muscle endurance, to accelerate the muscle recovery. So the EMS is mainly designed to make the muscles contract strongly, and it is used by the athletes for the muscle recovery. That is the main difference with the NMES. NMES is used in rehabilitation, and the EMS is used in muscle recovery for the athletes. The next one is the FES, means the functional electrical stimulation. So it is the use of electrical stimulation during a task, during a function. For example, a patient has foot drop, so he is facing difficulty to lift his toes when walking. So that causes the decrease in the step length, decrease in the walking speed. So that is a very big problem for him. So for the treatment, the FES is applied to the muscles which helps to lift the foot, means the dorsiflexor muscles, and that helps the patient to lift and clear the foot during walking. So by that use, the muscle strength, the ROM, can be increased. The next type of the current is the TENS. TENS means transcutaneous electrical nerve stimulation. So it is the pulse rectangular wave current which uses the frequency around commonly 150 Hz. The main use of the TENS is to decrease any symptomatic pain by stimulating the pain gate mechanism or the opioid system. Common uses of TENS are in the chronic pain, in the management of post-surgical pain, in the treatment of post-traumatic pain or any kind of acute pain. There is an intensity parameter in the TENS unit of 0 to 60 milliamperes, which is regulated by the physical therapist. The main motto is a tingling sensation should be felt by the patient. So the physical therapist asks the patient that he is feeling or not. After the TENS, we will learn IFT. IFT means interferential therapy. So it is the form of an electrical current where two medium frequency currents are used to produce a low frequency effect. There is an interference effect where the two medium frequency currents are crossed in the patient's tissues. So coming to the parameters, we use two medium frequency currents in IFT. One has the constant frequency of 4000 Hz and the other between 3900 to 4000 Hz. The difference of these two medium frequency currents creates the interference effect in the patient's tissues, and that frequency is called the beat frequency. The uses of IFT is seen in the sports medicine area to reduce pain, to reduce edema. The last on today's list is the Russian current, which is invented by the Russian scientist Dr. Yakov Kots. So it is a high frequency current, and it is used to strain the skeletal muscle and also used to relax the hypertonic muscles. The Russian current has a frequency of 2400 to 2500 Hz. So these are the most common examples of electrical stimulation in physiotherapy. There are various other types like iontophoresis, HVPGS, and many more. So we will learn those things in later in detailed videos. Thank you. Thanks for watching.